I'm asking these questions because I've had enough cases recently where I don't think that veterinarians and their staff and their technicians are actually being trained to monitor animals being given these potent drugs. And I don't think they even know how to reverse them, because I haven't seen any place where they have reversed them. Here's the thing. There are so many other drugs that are available to treat pain and to make them comfortable. And there's so many natural options, not even natural options, but just medications. Why are we going to these medications that are so potent they can kill the animal? It does not make any sense to me whatsoever. Who is coming up with these protocols? Who is telling veterinarians out there, oh, use gabapentin and methadone together, when there is a 2019 FDA warning that can cause respiratory depression and kill patients? It does not make sense. Like a lot of things in the world right now. But
שתפו את הפוסט כדי להציל חיים ולחסוך שברון לב מאנשים.
2 small dogs lose their lives because of an overdose of methadone. 2 days ago, I saw another 5-pound poodle, whose parents were very urgently wanting to see me. They had said their dog had had an episode, and a really severe episode, and they didn't know where to go next or what to do next. When dogs have episodes kind of out of nowhere, it takes some hunting around history-wise to sit and really listen to the clients and try to get certain descriptions out of them to figure out what was going on. And they told me that this 6-pound miniature poodle, 5-pound miniature poodle, 6 years old, that had no previous medical history, was going out for a walk one day and suddenly inside their apartment building fell over and hit its head on the floor because it fell so suddenly, and its tongue started turning blue and purple. And when they went to pick it up, he was just limp, completely limp and unconscious. And they thought he had literally died a sudden death right then and there. So their neighbors came over to help. They started blowing air into the dog's mouth. When they did that, the tongue pinked up. They tried like the Heimlich maneuver, where you swing the dog back and forth in case there was something caught in the dog's throat. I'm just giving you the highlights of this. And then they called to find out where the nearest emergency clinic was, and they took the dog into the nearest emergency clinic. Now, when a dog has an episode like this, we think of many different things. There could be a cardiovascular incident. There could be some, major bleed out episode happening. There could be seizure. There's a long list of differentials. But my point is, when you go into the emergency clinic after having this type of a severe episode, by the time they got there, he was coming back to conscious awareness. At the emergency clinic, he was medicated with a dose of gabapentin combined with methadone. Now, this is where the story gets interesting. This is one of the pain protocols that I am seeing used very commonly in a multitude of different cases. Gabapentin plus methadone. And without pet parents don't have pharmacology degrees, don't understand drug usages, what the potentiality are these drugs. But my question for our profession is, what level of pain merits the use of a high potency, long acting opioid like methadone? Question number 1. I practiced for years and years and years, and we never pulled out the methadone. We rarely pulled out the morphine, usually for bone surgeries or orthopedic surgeries or something like that. So anyways, that's question number 1. What level of pain actually merits the use of that drug? Because that drug is given once every 24 hours, and that drug is extremely potent. And there is a very fine line between adequate pain management with opioids and overdosing with opioids. Now, an opioid overdose, the drug actually affects the brainstem and turns off the respiration, causing respiratory depression. It then slows down the heart, which is a condition called bradycardia. So why would you give a dog that had a serious collapse episode, of which we still don't have a definitive diagnosis? The tests haven't been run. The dog later went to see a neurologist, later went to see a cardiologist. None of this had been done. And that dog was given a drug that can potentially decrease its respiratory rate, decrease its heart rate, and has a very narrow threshold of going over into overdose land. Now, when you combine that drug with gabapentin, we get a whole nother complicating factor, because in 2019, and this is something that probably many people aren't even aware of, in 2019, the FDA actually posted a warning, and I will put it in the comments before, that the combination of gabapentin with opioids can cause severe respiratory depression leading to death. I'm going to leave that right there. Now, my question when using methadone, back to these drugs, is the veterinary staff trained on how to monitor animals giving these high potency opioids? Are they trained to recognize symptoms of overdosage with these opioids, which include respiratory depression and a slowed heart rate? Do they know how to use the reversal agent Narcan to reverse the effects of methadone or these long-acting opioids? Do they even have enough Narcan on hand on the shelf in order to reverse the effects of methadone? Because you see, methadone is such a potent opioid that speaking to emergency paramedic technicians who I know personally have told me that they have often, if a patient is on methadone, they have often had to re-administer Narcan every 15 minutes in order to reduce the dangers of overdose and have that patient die from respiratory depression or arrest. I'm asking these questions because I've had enough cases recently where I don't think that veterinarians and their staff and their technicians are actually being trained to monitor animals being given these potent drugs. And I don't think they even know how to reverse them, because I haven't seen any place where they have reversed them. Now, what's really scary is one of the cases that actually died later, the animal was given methadone and GABA and was on an infusion of another drug, and the heart rate and respiratory rate started going down. The clinic called the owner saying that the dog was dying. Did they want to euthanize? When the respiratory rate and heart rate went down, they took that animal off the infusion of the drugs, and the heart and respiratory rate came back up. But somehow they didn't recognize that was a problem, because when the owner said no, continue treatment, they hooked the dog back up and everything dropped again. Now, I know this because I asked to receive the records where they are recording down heart rate and respiratory rate. So there was no recognition that these drugs were causing those problems. Luckily, she went over there immediately and asked to have her dog removed from everything and taken back home, and I met her at the house, and we got the dog through the episode. We actually sat there with the dog for 4 hours as all the drugs weared off during the system and kept him awake and stimulated to come out of the episode. So Again, I'm not pointing fingers at anybody, but I think we as a profession, veterinarians out there, people out there prescribing these drugs, we need to know what we're prescribing. We need to know how to monitor the patients who are being given these drugs. And we need to know what the side effects truly are. Because your drug representative that is walking in your clinic, or the person that is in your pain management continuing education class, is obviously not giving you certain information that you need to know. So I don't want to see any more dogs die from the use of these drugs. Okay? And this is why in case you don't know, and many people don't know, methadone was originally used as the answer to get people off of heroin. And I had a very good friend way back when who was actually on the federally mandated methadone program. And he told me a lot of that drug and a lot of using that drug. And it turns out that methadone is actually more addictive than heroin is. So, it's just crazy. There are so many, and here's the thing, there are so many other drugs that are available to treat pain and to make them comfortable, and there's so many natural options, not even natural options, but just medications. Why are we going to these medications that are so potent they can kill the animal? It does not make any sense to me whatsoever, and I'll probably be blocked on Facebook, but good friend, her dog she had to take the dog in because he wasn't urinating. She was afraid he was blocked. He ended up with urine crystals. They treated the dog with urinary crystals with gabapentin and methadone. That's just insane. It would be like you walking in with a UTI and your doctor handing you a prescription to go down to the methadone clinic. It doesn't make any sense, people. And I'm all for pain relief. I spend most of my practice managing pain, especially on older animals, on animals with chronic disease, on animals with severe arthritis, on animals in end-of-life care. But I'm not drugging them up to turn them into zombies. At that point, we might as well put them to sleep. Who is coming up with these protocols? Who is telling veterinarians out there, use gabapentin and methadone together, when there is a 2019 FDA warning that can cause respiratory depression and kill patients? It does not make sense. Like a lot of things in the world right now. But as a pet parent, what I can tell you, if you're not good about remembering the names of drugs, and I know when you're not medically trained, it's very difficult. Take a piece of paper or get your phone out right now, write down gabapentin, methadone, so that if you have to go into an emergency room clinic, you can tell them, I would tell them my dog has an allergy to these and had a super bad reaction to these two drugs. Please do not use them. There you go. I had one pet owner, he would sleep with his arms around his dog. His dog was on gabapentin and opioids, had gone through surgery, was sent home with them. He was sleeping with his arms around his dog at night because she would stop breathing in the middle of the night, and he would feel her and wake her up and rouse her. Now, something is wrong with this. Very, very wrong. This 5-pound poodle was given both of these drugs, then developed severe ataxia, which is where they're wobbling around because of the drugs, had this decreased respiratory rate, decreased bradycardia. So then the specialists, when they were examining the dog and trying to figure out what was going on, it confused the entire case. Was it neurological because of the ataxia? Was it a cardiovascular incident? Because they didn't the neurologist did take into effect the drugs and refused to put the dog to do an MRI on the dog because they did not have a diagnosis on the collapse, and he did not want the dog to die from the anesthesia. Okay, so that's smart, and that's a doctor that's thinking, a veterinarian who's thinking. But the ER docs have still given the GABA and the methadone. So something needs to be done. And it may have to come from the actual pet parents walking into these clinics. So I'm just giving you guys a heads up. And like I say, the best thing might be, they might say, oh, they can't be allergic to opioids. Say, well, my dog is allergic to opioids. Don't give them.
הרפואה הגדולה מכולן היא ללמד אנשים איך לא להזדקק לה. וזו הייתה דוקטור ג'וזי ביו. אנא שתפו את הפוסט כדי שנוכל להציל כמה שיותר כלבים מתופעות לוואי ומוות מיותר שווטרינרים פשוט לא משייכים לרעלים שהם נותנים. כי בשבילם הרעלים הללו הן תרופות טבעיות וטובות. וכנסו